forum where you'll be able to see through the slides. The link to that was in your email invitation, but it's also now in the MS Teams chat. So there's a link, it will open a browser window and it will take you to the slide presentation and, more importantly, a space where you can add your comments and questions as we're going through this afternoon's 1 hour session. And we're expecting 200, 250 people on the call. So, of course, I know every single one of you will have questions and reflections and comments. We are absolutely encouraging you to capture those. We may not get round to, or in fact, we won't get round to all of those questions during this time, although we've got a good 25 minutes for Q&A after the presentations. But just to say that those comments and perhaps some good practice and your questions will be picked up afterwards, and we will respond, not necessarily to individual questions, but certainly to the groupings of questions that we are looking for you to capture this afternoon. So please check out the link. Amina is also going to share the slides here in MS Teams, and therefore you'll also, if you can't get to the forum or don't want to use the forum, you can put your questions into chat in MS Teams. But the advantage of the forum is that everything you put in there is anonymous. So we're hoping to get your actual thoughts and reflections alongside your questions. So welcome everyone. We've got over 200 people in the meeting. My name is Steve Bather. I'm hosting this webinar, and I will be back in about half an hour to help pose questions and comments and summarize some of the things you're saying. Again, the forum link for those of you who are just joining is in the MS Teams chat. Click that, open the window, and please capture your thoughts, reflections, examples of good practice, and of course your questions back to the panel. So I think as we settle in, I'm going to hand over to Annie Hudson, who's going to welcome everybody and kick us off into this webinar. Annie.
Good afternoon, everybody, and thank you very much for joining us for this. This is the 5th webinar we've done following the publication of this national review, and it's great to see such a good response and such a good response from across different agencies and sectors involved in working in frontline practitioner and frontline manager roles. So thank you for joining us, and I hope that it's going to be it will be a useful and helpful kind of event. As I've said, we've done 5 of these. We did a couple of them for the local safeguarding kind of partner and workforce related to that in Solihull and in Bradford. And then we've done 3 others, which are kind of more for kind of general interest across England. We did one for business managers, we did one for safeguarding partners, and then this one today, which is for frontline practitioners and managers. And we've shaped and fashioned the content according to that kind of audience. However, if there are things that I don't explicitly reference in the presentation I'm going to do in a minute that you want to raise in the Q&A session, then please feel free to do so. I'm going to assume that all of you, if not have read the whole thing, are fairly familiar with some of the kind of key issues. There's obviously been quite a lot of kind of media attention at the time of the report publication, and then again this week when myself and colleagues from Bradford and Solihull went to the Education Select Committee in the House of Commons. When we embarked on this review, and obviously it was a review that we hadn't planned for, but was in many respects in response to the conclusion of the criminal trial of relating to one of the children, Arthur, in late November, early December. But in planning and embarking on this review, we set out to be fair, to be just, and to be robust. And obviously you and others will be the best judges of whether we have delivered that. We wanted to make sure that not only did we provide an authentic and evidence-based account of what had happened to these 2 children and respecting the individual differences of their lives and indeed the horrendous and tragic circumstances of their deaths and the places that they were brought up in, but also to address some wider issues about child protection, the design of the system, the delivery of our very important child protection responsibilities that we all have and which I know everybody takes really seriously. The session today will we're going to focus particularly on some of the practice issues that have emerged, and particularly those that we think have wider resonance through the work that we see as a panel, looking every year at about 500 different reviews, rapid reviews and local safeguarding practice reviews. And I suppose I also really wanted to say, particularly to you and those and your colleagues today, I think, and I really genuinely believe this, that I think those working in the sort of front end of child protection and safeguarding have one of them undertake some of the most difficult, onerous, challenging and complex of public services. We're not always as good as we might need to be in making sure that the public and indeed the media and some politicians understand that complexity, but we all know that it is very complex, and the work that you do every day is really difficult and really tough. And we also know, and we were clear about this in the report, there is much strength in the practice that's undertaken and the very many children every day whose lives are protected. And I think it's really important to have that sense of proportionality in embarking on this discussion, and that was certainly important for us in undertaking the review. I also wanted to emphasise how really engaged, open and reflective colleagues were in Solihull and Bradford. It was a fairly tough kind of moment, series of weeks for them because they were so much in the kind of public limelight. But practitioners, managers, leaders from across those two kind of areas were extraordinarily kind of open and reflective of what could be learned, because this has been about what can we learn so we can better protect children in the future. Today, I've got with me, literally in the room, two colleagues who are part of the subgroup from the panel, working with Secretariat colleagues and our team of reviewers. So on my right, Simon Bailey, who comes from a police background, and on my left, Renuka Rajar-Dent, who comes from a voluntary sector and child psychologist background. And also on the call from the panel is Peter Sidebottom, who is a consultant paediatrician and emeritus professor of child health. So you've got four of us from the panel and also some of our panel colleagues, Secretariat colleagues.
I think people are struggling to hear. So I'm going to pull this closer to you if possible.
Sorry?
People can hear. Oh, other people can hear, so maybe it's just a specific problem. Some people.
Can you? Okay, is that all right? Put something in the chat if you can't. Oh, good. Okay, thank you. So I'm going to run through some slides and then we'll pause for question and answer, because that's usually the best way of doing it when we're all talking virtually. So I think, Steve, are you going to put up the slides, or Amina, you're going to put up the slides? Just the first slide really is just setting out our contents. So we're going to talk through the methodology of the review and the context of the review, move to key findings, and we'll frame that in a particular way, which I'll explain in a minute. And then we'll focus on some, but not all of the recommendations, because we just don't have that time. So are we there yet?
Yes.
The slide deck?
1 sec.
So, okay, well, I'll just keep talking. I'm not going to go into a great detail about our role as a panel. I'm kind of assuming that most of you are fairly familiar. As you know, we're an independent, next slide, I think, Amina. We're an independent body accountable to the Secretary of State for Education, and we have a broad function around identifying, commissioning and overseeing the reviews of instances where children have suffered serious harm. We are a multidisciplinary panel, and we have people from, different sectors, different disciplines, including statutory and the third sector. And our role is, as you know, to comment on and respond to individual local reviews, rapid reviews and safeguarding practice reviews, and then on occasions to commission national reviews. And this was the fourth. There's another one coming along soon, which is actually to do with residential school and provision to children with disabilities and complex needs. This was the first time we'd done a review about individual children, or published a review about individual children. The other ones on issues such as sudden unexpected death in infancy, criminal exploitation and non-accidental injury in under ones were thematic reviews drawing on case material but not about specific children. And that's who we are, the pictures, including those of you who are social workers, Isabel Trowler, who is, as you know, the chief social worker. And that multidisciplinary focus means that we have lots of challenging discussions and debates between us, reflecting our different professional backgrounds and knowledge, and in a way, kind of, I know, playing out some of those, you know, kind of myriad kind of debates and discussions that happen, you know, really constructively and very fruitfully at a kind of local level. So in a way, we're sort of like a national version of the safeguarding partners, with a particular task around encouraging learning and making sure that the learning that we have from all of these serious incidents actually makes a difference to children. And that's the sort of $64,000 kind of question for us. So moving on to the methodology and context of the review. Next slide, please, Amina. So at the beginning there, just a kind of, you know, a sort of snapshot of the facts really about the deaths of these two children, aged 6 and 16 months in Solihull and Bradford, respectively. And in both instances, the child, one of the parents of the children, was convicted of kind of related offences, manslaughter and conviction for allowing the death of the child, and then the partners being convicted of murder. And what's I think one of the things to note is, and we talk in the report a bit about when we're talking about issues about biases and assumptions, one of the facts about these two murders is that the partners were both women, and that's quite important, particularly in the context of the work we've done hitherto about NAI and the sort of prevalence of fathers and thinking about gender in terms of men and masculinity. And so there's some sort of slightly different issues here. We had 3 phases for the work. The first one, the first one was to sort of brigade, in the words of Jane, one of the secretariat colleagues, brigade the resources. So there was a small group of us from the panel, so the 3 of us sitting here today and a couple of other colleagues, including Isabel Trowler, who formed the sort of panel subgroup. And then we commissioned from our team of reviewers, we commissioned some expert reviewers led by John Harris, who's done a lot of work for the panel, including being the sort of key architect of things like our annual reports. So that reviewing team did a lot of the very early kind of work on putting together a chronology, going through masses and masses of paperwork from and records from all the different agencies, including, because work had already, a lot of really good and important work had already taken place in relation to local safeguarding practice reviews, so sort of absorbing all of that. And of course, we started out with Arthur, and then sort of 2 or 3 weeks later, it was agreed to, so, if you like, fold in the attention to Star. And that proved to be quite hard, and in a way kind of added complexity to the review. But I think as a kind of review team, we felt its added richness, partly because it meant that some of our recommendations could address common themes, but also we could then look at how those common themes we could triangulate with wider evidence base from the panel. So first phase, looking at chronology, the significant events, really homing in on those key practice episodes where important pivotal decisions were made by professionals, either singly or together, about a child. And we think that's a really helpful way of looking at any significant incident. And, you know, we would commend it really in terms of local safeguarding practice reviews generally. And then the second phase was the longest phase, probably. We interviewed around 80 or so family members, quite a lot of family members, and professionals. So everybody from frontline practitioners through to managers and senior leaders. we also, and we sort of set out to do this from a very early stage, we also started to draw down and commission wider evidence. So we looked at both our own evidence base, we looked at some data, national data and data from the local areas, and then we commissioned the behavioural insight team, who are a team who've done a lot of work on sort of nudge and things like smoking cessation. They've done some work on children's social care, and we commissioned them to do a bit of work on the optimum conditions for making high-risk decisions in very difficult, challenging contexts, because that was obviously very pertinent. And their insights have been very crucial in taking us to some of the recommendations about multi-agency working. And we also had a challenge group. This was very much a kind of idea that my colleague Renica kind of promoted, of bringing in people who know nothing really about child protection and getting them to sort of challenge us a bit from their knowledge and expertise in other kinds of high-risk environments, like counter-terrorism, for example. And then a lot of work, particularly as we moved through, we got a sense of our findings of engaging with different stakeholders. We had a practitioner event, we had an event for senior safeguarding partners, so on and so forth, multi-agency focus. So using all of that data and evidence, soft data and soft evidence to frame our recommendations. And the recommendations work started kind of quite as early as we could, because there's no point in coming up with lots and lots of recommendations which have no basis in evidence. So it was really important to get the kind of evidence base and then to kind of craft and deliver the report. And that was all quite pretty hard 3 or 4 weeks, I think, at the end. But we were determined to meet the 6-month working together deadline, and we did that by about 2 weeks, I think. So the next slide, and this just to kind of say something very briefly about this was developed very much by John Harris, who I've already said is our lead reviewer, done lots of work for us as a panel, comes from an education background, was a director of children's services for many years. And John has a very forensic mind, and he was an absolutely phenomenal person in terms of gathering all the data and the facts about what had happened to these children and putting it together in some form, and use this framework which he'd developed for another piece of work which we will publish later in the year, which was a general piece of work around risk assessment and decision making, as being one of those perennial themes which we were so keen to use this review to address. And I'm going to say something about each of those domains because it's issues and factors in each of those domains which can combine in different ways to influence and shape a decision about, what happens to an individual child on a particular day, and so is so very important. And we are finding it very useful to use this framework in making sense of those perennial problems, those sort of Groundhog Day issues around information sharing, around risk assessment, and so on. So I'm going to what I'm going to do now, in a minute, is use those domains to kind of say a bit more about our findings. So what we've done is in looking at what happened to these two children, is to identify a set of issues which we think, and we believe we have good evidence to show, hindered professionals' understandings and decisions about these two children. And the first, some of these things are very familiar. And if you're as old as I am and been around as long as I am, these are issues, these issues have cropped up in reviews, not just this century, but also last century. If you look at Tara Henry, Jasmine Beckford in this century, Victoria Colombier, Peter Connolly, and so on, and even right back to Maria Colwell in 1973. So, the big thing about information sharing and information seeking and between and within agencies. And this was, a really fundamental issue in what happened to both Arthur and Star. So, for example, when there were allegations being made by families, come on to that in a minute, about bruising to Arthur, information went into different bits of the police force and then different parts of children's services and at different times, and there wasn't that joined up clear picture of what was happening, not really engaging with other bodies, including health and schools in relation to Arthur. And that happened very strongly and clearly with Arthur during 2 critical weeks in April, and then it happened in a kind of more serial way with Star over several months, when there were a number of repeated referrals, and that picture over time, particularly with her, just wasn't put together. That sort of episodic response, which can be so problematic. And the second thing, and I think in some ways this was almost the most visceral issue, perhaps, in a way, for us as a panel, kind of developing our knowledge and understanding and appreciation of what happened. And this was partly because we did talk to quite a number of family members, is that the family concerns were not listened to, they weren't heeded, and too much was taken at face value. And we could see it wasn't just like one statement of concern, it was repeated statements of concern from different family members with both children. And what happened was that there was the framing of concerns in ways which one became very set and fixed, so that they were malicious. So with Star, the framing and the child's mother and her partner kind of clearly contributed to this, and this is the taking at face value, saying they were malicious because they didn't approve of the her same-sex relationship. And similarly with Arthur, it's because they don't approve of this new relationship that Arthur's father had with Emma Tustin. So that too much taking at face value and just not heeding to concerns. And we think that the notion of malicious allegations is actually really problematic. It's much more, they may not be substantiated, but framing things as malicious means that they get fixed. And this issue about bias and confirmatory bias is such a powerful issue in both of these children's instances, but we do see, sadly, in too many others. And linked to that is that lack of robust challenge and reflection, not having good supervision, but also across and between agencies. And that failure on a number of occasions to trigger statutory processes, including, most noteworthily, strategy meetings. And since we started this work in January, I have been noticing, as we get about 30 or so, I think, isn't it, cases every fortnight, that lack of strategy meetings is sadly, I think, quite too often occurring. We see really good ones, but also they're not happening. So what you don't have is that bringing together of health, children's services and the police with their different expertise and knowledge to challenge and to plan. So, for example, going off, as happened in both cases, and phoning a family, a parent, and saying, we have this concern, we have this allegation, we want to come and talk to you about it. So giving people a chance to get their kind of story, and sometimes to get children to kind of, be clear what they're going to say. And that led us into finding around, child protection is so complicated, and it requires some really particular kinds of skills and expertise. But also it's the leader's responsibilities to create the conditions for this complex work. And there's a really clear phrase we say about, unless we, it's our rationale for the changes we think we need to be made, unless we change some aspects of the conditions, we're going to continue to make it really difficult for people to do the right thing at the right time. Now, going on, there is a question about, why these issues persist. And it is because it's complex, it's challenging, because the work requires people to have particular capabilities and particular expertise and knowledge. And it's really difficult blending, the care and the control and using the authority well. And that's not just about social work. And I really emphasize that. It's about police work. This is not just about critiques of local authority social workers. There is critiques of other professional groups you will see in the report. And we're saying we're asking, the system actually doesn't give professionals the best opportunity to succeed in this very difficult task. And therefore, nationally and locally, we need to strengthen our systems and frameworks. I'm not sure I've got an awful lot of time, and I'm going to just whiz through the next 2 or 3 slides. So using those domains, there are some we articulate this in the report, some really important bits of practice knowledge about the speed with which life can change for a child, particularly with Arthur, lockdown, moving in with his father into a new household with other children, and how quickly, and particularly in that context, possibly how things change. Hitherto, his life had been okay. He'd experienced some real trauma with his mother being imprisoned and so on. So that's kind of really important. And that issue about bias and beliefs when we're working with different communities, different families, how we need all those checks and balances to make sure those beliefs and biases are not actually detrimentally affecting our judgments. And how, investigating allegations, as they will be when families have harmed children, they're not going to be mostly, many will, but lots won't want to engage. So that listening to what families, wider families, know, because they will know children well, is so very important. And then there is this really important specific theme about domestic abuse, coercive control, and in relation to Arthur, the needs of children whose parents have been imprisoned. On systems and processes, this point I've sort of rehearsed already about that joined up picture. There's a quote in the report from a conversation that Isabel and I had with Lord Laming about his review, about how professionals there, in that case with Victoria Glimbeck, kept saying, if only I'd known, social worker saying, if only I'd known what the paediatrician had seen, if only I'd known, says a health visitor, what the social worker had seen. And I think there was quite a lot of that here. And our sort of the drive of our recommendations is that we've got to have a system where we are much more likely to have that joined up picture of what's happening. Schools for school age children have the massive information and knowledge about children. And that information sharing, must be important. There was a real issue about when and with whom photographs of the bruises were shared. And then when the local authority got it, by then, there was so much water under the bridge, they decided, and we were very critical of this, they decided, well, actually, we've seen the child and everything's okay, despite the evidence about the bruising. And that goes back to that whole thing about critical challenge and thinking. But we know that's difficult, and we've got to have some systems that enable people to have the resources and the capacity to do that. And that leads into the kind of leadership and culture question. And there are points in our report about the role of safeguarding partners. We have to have a culture of learning and reflective supervision. So, because too often, stuff was happening so quickly in this rather episodic way. And so people weren't sort of stopping and thinking and reflecting and saying, what could be going on here? And that, takes us back into management oversight, as well as, the role of senior leaders and the importance of senior leaders having that line of sight and their fingers on the pulse. I was director of children's services for 10 years in 2 very different places. And I know that's difficult, but that's what I think is the task of leaders, is to constantly check out, find out, be really curious about what is really happening at, at the front line with people, colleagues like you are doing. And then last but not least, the wider service context. There's a lot of this in the Josh McAllister report. We work very closely with Josh in framing our recommendations. And there's a lot in that about social worker. But we're also saying that we need to privilege and resource kind of development around working in a multi-agency context. And there are clearly major issues about, you know, socio-economic factors and that how that shapes what happens. I mean, it was particularly highlighted in Bradford, which I think is the 5th most deprived authority in the country. So the last thing is just those recommendations, and I think you know, the one which I imagine you may want to talk about is the sort of the delivery recommendation, which is about multi-agency teams being responsible for child protection investigation, planning and review. And that would be a very big change in the design of the system. We think that has to be done to address some of these perennial issues about information sharing, about siloed decision making, and address those fault lines in our system. The others are all enabler ones. The big message to government, we're sitting in the DfE, is that government needs to work more robustly across departments with a cross-ministerial oversight on child protection. And, you know, they have announced, and I know I've just been talking about it, that there is going to be a cross-government ministerial group. That's the first step, many more to go, but I am assured and reassured by that. But we think that needs to be not lots of prescription, but there needs to be a much stronger multi-agency national framework. And if we don't establish that, then some of the perennial issues that we saw very much reflected in what happened to Star and Arthur, but in relation to what happens to too many other children. And I'm going to stop there. Thank you very much. Over to you and your questions. And I think Steve will probably give us, he'll been tracking.
Yes,
your comments.
Thank you, Annie. Thank you, Annie. And that was quite a swift run through. So I do want to give people time just to reflect and think and capture their questions. You can, of course, put them in the MS Teams chat or straight into the forum. We've got about 2/3 of the people who have made it to the forum. And that's also where we can respond after the event as well. So, Annie, a couple of things that came up. I think one of the questions is looking for a bit more about the challenge groups and the role that you spoke about. And Renika perhaps can pick up on that. Number 4 talks about commissioning and local resourcing and team capacities, considering the case. So I think that's the resources question about what the frontline professionals are being asked to do and how they build that capacity, and how much of that was taken in during the review. 5 talks about the role of the challenge group. Sorry, I've mentioned that already. And a really nice, very generic question, number 6, from the perspective of a practitioner, do you think we have identified the key issues in these reviews? Pick up on some of those and perhaps start with the last one about do you think we've picked up on the key issues?
Right, so if Renika takes the first one, I'll pick up on resources, then Simon will do identifying issues. Right.
In relation to the challenge group, about halfway through our review, recommendations were beginning to come to the fore. We thought that we would bring together a diverse range of people from economics, from data, from psychology, from behaviour change and so on, to come together and to think about, were we missing something? We thought to ourselves, we've been making changes for a number of years and we don't want to keep doing the same thing, hoping for a different result. And as Annie said, we have our key recommendation, which is about structures of multidisciplinary units and trying to implement that as a must-do in every SP. As a support, one of the recommendations from the challenge group, which we hope will be taken further, is recommendation number 7, which is about, could data be used as an enabler to hypothesis testing? And as an example, a number of the reviews that we see indicate that children have been hidden in plain sight for a number of years. For these children, as Annie has said, there were several escalations by different family members, these 2 particular children. We asked ourselves the question with the challenge group, could data, for example, have helped us realise that the concerns came from a variety of people in a short space of time. Might that have prompted a different behaviour in professionals? And also emanating and included in the challenge group was the report from the Behaviour Insights team, which we think is a particularly interesting one, don't we, Annie? And which we hope perhaps we will publish.
Yes. So that particularly for the Behaviour Insight work particularly formed the sort of one of the key foundations for some of the thinking about multi-agency units, because it was really promoting the evidence about working in teams and so on. So yes, I mean, we hope that we'll find a way of certainly sharing that in those insights from Behaviour Insight. Okay, thanks. So do you want to pick up, Simon, on the key issues, and then I'll come back to resources and capacity?
Yes, of course. So very briefly, this review has drawn not only from the incredibly deep analysis and research that's gone into Arthur and Starr, but also from the learning of the panel's review of 400 to 500 rapid reviews or local practice reviews every year. So we've now seen during the life of the panel over 1,000, and consistently coming out in all these cases that we are reviewing are the same failings. And what we saw in Arthur and Starr is replication of those failings. So what we've endeavoured to do with the recommendations that have come directly from this report is that goes to the heart of those consistent themes that are coming through. So I think from a practitioner's perspective, please be assured that we have looked at all these issues. We have looked at it from the challenges that you face every single day, with a view to making some significant recommendations around how this improves. And as Redeker has said, at the heart of that are those multidisciplinary, ideally co-located child protection teams, because the biggest challenge, and it's coming through really clearly on the questions that you're asking, is the issue around information sharing. And one of the ways of breaking through the cultural issues of information sharing is undoubtedly the creation of those multidisciplinary teams. So I'm confident that we have identified recommendations that, if put into practice, will make a real difference to you working on the ground, and they're taken from a raft of cases that we've been able to study and all the learning that's come from them.
Thanks, Sam.
I just wanted to say that in all the cases that we read in panel, there is, of course, the issue of information sharing, but there are also cases of a lot of information in one place not being analysed properly. And I think that's really important to recognise. In one review I read recently, the reviewer concluded that the professional network worried about what they didn't know rather than properly analysing what they already knew. And I think we really need to hold on to that fact too.
Yeah, that's right. No, that is a really important. It's the sort of information sharing, and then it's the kind of challenge and analysis. So just on team capacity and resources, and you'll see in the report we talk quite a lot about, particularly in relation to Bradford, with very, very high agency usage of social workers, but also kind of major challenges in terms of health visitors. So it wasn't just one agency. Less evident in Solihull. What the subsequent Ofsted JTI in Solihull kind of highlighted in January, I think it was published, or February, was the kind of capacity in the MASH around multi-agency input. So I think there are issues about capacity for particular professional groups. The care review is got, I think, some very bold and important ideas and proposals about, career pathways for social workers and so on. And I'm sure there are parallel developments going on in other professions. But I think it's also, we would say, both safeguarding partners and professionals like yourselves working frontline roles. It's also about creating the conditions and giving people the skills for working with professionals. So, Simon and I have this, sometimes if Simon and I are back talking about this, I realise he's got, he's talking in a kind of police code and I'm talking in a social work code. And you have to kind of unpack that to really get to the sort of deeper meaning. So multi-agency work takes time and you have to invest in it, and you have to have the kind of capabilities for working with it and, you know, putting yourself in the other's shoes. But it is so crucial, we know, for protecting children. So we ignore it at our peril.
Thank you, Annie. Yes, Renica picked up on it's not only about information sharing, but it's about what you do with that information. And comment number 13 has picked up on that. So thank you for the contributor who put that in. Number 7, 9, 8, 13, 14 and 17 are all about information sharing. So perhaps we can pick up on that. Number 17 specifically, thank you for the interesting presentation. It's a common theme around the learning. The co-location may help with information sharing. However, there needs to be a cultural shift around partners feeling equal and having their voice heard. And that if you look at in connection with number 14, why can't professionals work from one IT system so all information, when relevant and purposeful, can be shared? Simon, this is one of your areas of special interest. Just pick up and talk through some of the concerns and opportunities there.
So I'll be very candid. Why can't professionals work from one IT system? They absolutely could, but it requires my former colleagues, Chief Constables, Director of Children's Services, to agree actually we're going to cede a little bit of ownership of something and agree that actually we will compromise. And whilst the system might not be perfect from a policing perspective, the benefits of a multi-agency system outweighs the siloed approach. So there is no reason why we shouldn't. The technology exists, but I think we have to look at this through the lens of different organisations trying to come together, that cultural clash, that sense of ownership. It becomes really difficult, and actually we have to cast that aside. And I think that is so important. And ultimately, I agree, it is around partners having an equal voice, but that means that all partners have got to commit the same level of resource, the same level of money to achieving that overarching aim. And unfortunately, I think during the years of austerity, it was easier to withdraw behind the walls of your own organisation, and leaders like myself became protective. And unfortunately, we missed the opportunity to really embed multi-agency systems. And look, there will be colleagues on this call that will know of good multi-agency safeguarding hubs that are making a real difference. It works. We know that. We just have to have the confidence, and ultimately it comes down to the strategic leaders to have the confidence to turn around and say, do you know what, we're going to make this work because we have a responsibility to. And all I would say from a practitioner's perspective is, please, when you are dealing with these cases, don't be, how can I put it? Be respectful, of course, of people who are in a position of authority and rank, but also be mindful of, if you have a real concern, just don't let it go. And unfortunately, in the cases that we have seen, there is deference to people that hold titles. There is deference to certain professions, and on occasions, that deference is getting in the way of really good safeguarding practice. So if you think a child is being failed, just don't let it go. Don't let it go. Be passionate about it. Keep making the point. Build that evidence, and you'll start to cut through this, and then people will start to see the benefit of that of what can be achieved when you work together, when you start to create that joint culture.
Thank you, Sana. Renica?
I was just going to say that there was a comment on the chat about paediatrics, really, and bruises and so on, yes, and the importance of actually multi-agency input into that. And you know, it is possible, I think, that a step change in also the use and the efficiency of data can bring knowledge together at the same point rather than in sequence or in parallel.
Yes. Yeah, thank you. And I think there was an assumption around co-locating being part of the promotion of better information sharing, but there is a comment that says number 19, many areas have co-located MASH now. I'm presuming this wasn't the case in these two tragedies. Do you have that information to hand? Did their MASH co-locate?
My recollection, I don't know about at the time. So, but this is to do with the visits I have had to those individual areas since then, is that certainly in at least one case, one of the areas, and I can't remember if it's in both, that people were co-located. Whether they were in 2020 when these children died, I don't know. But
COVID.
Yeah, I mean, but I suppose what I think co-location is one aspect of it, but I think more crucially is what, Simon and Renica have been talking about. It's about actually kind of sharing information and having one culture. We talk a lot about culture and, we can kind of get a bit obsessed with it, but it is the glue that can actually make people work together, respecting their differences. And that, for me, it goes back to those of you who've been around a long time, but the kind of, when we were talking about every child matters, about the salad or the soup, and actually it's not about blending everything together. Simon and Renica have got very different skill sets to me, but the point is, I think it's about using those different skill sets and knowledge to actually work out and make the best possible decision. But you need time for that. You do need to be co-located as far as possible, but that's not the only that's the only measure. We're saying these teams need to be one team, a bit like youth offending service teams are, and kind of managed by one person on a day-to-day basis, but accountable to the tripartite that makes up for the local safeguarding partners.
Thank you, Annie. And I want to come on to talk about leadership and culture, and a little bit more about the bias and beliefs, and perhaps the assumptions about why people are getting in touch, particularly from the extended family. But just to cover off a couple of other points, the question has been answered in the chat, so that's been very useful. Thank you very much. But it talks about child protection medicals. It's number 12, and the challenge for social workers without medical experience. Without a medical expert confirming the injuries are non-accidental has been significant with providing evidence in court. How can we effectively challenge this? On this occasion, the police were clear that Star's injuries were suspicious, but the medical expert did not agree. How then do we move forward? And perhaps that can be taken in the context of one or two others about number 9 as well, which is the investment issue. Of course, do we not need investment regarding early work done to avoid meeting the threshold of child protection? So, what's the overlap around how we manage and the input from experts around the type of injuries and how they may or may not reach the thresholds for child protection?
So Renica is going to kind of respond to the issue about families and bias. And then because we've got Peter Sidebottom on the call, Peter, yes. Are you there? If you, Peter, could respond to the issue about the CP medicals, because I think you're best placed, and then we can pick up here about the investment issue. So Renica first.
Yeah. In relation to families and voluntary sector organisations, and people at the grassroots who know and work with families, I think the simple answer, but difficult to put into practice, is we really need to take them seriously as informants. And telling the difference between information that is valid in relation to the child and information that might be just scattergun and not valid in terms of hypothesis formulation is not easy. But our message, I think, from visiting the families is that there were real concerns and there was a real granularity of their knowledge in relation to what quite quick changes, as Annie mentioned before, into the dynamics that they had moved into. Surprisingly quick. And that was something we really had to take seriously in this review, and why it is writ large in what we have written. We have got to listen, even if later we decide that what we have heard is not valid in relation to danger for the child.
Yeah, no, thank you. And that's one of the 4 recommendations and sort of exhortations we've given to every single local safeguarding partner, is that they look at their local practice around this, because it's so important. Peter, can we bring you in now?
Thank you. And yes, I've already put a comment in the forum in response to the question about child protection medicals, but it is a really important one. And I think recognising that the medical evidence is an important part of the jigsaw, but it is only one part of the jigsaw. And I think with that perspective, this sort of real emphasis on multi-agency specialist work is really crucial here, that what we're dealing with, we need the medical practitioners with the competence and confidence to do this medical side of it well, and to be able to give an authoritative opinion. And so we need to support our practitioners, we need to upskill them, give them the skills they need to do this well, to be able to draw on the evidence base that there is there, but also recognise its limitations. And that then sort of comes into actually seeing them as a central part of this multi-agency team. And I think the co-location can go a long way to recognising that. And you mentioned earlier, Annie, the importance of strategy meetings. I think involving health professionals right at that early stage in the strategy meetings as a routine, not just when somebody decides there's a particular medical issue, but actually right the way through, sort of having that input so that the information can be discussed and thrashed through, and people can ask about the nuances. Well, this doctor has said this is consistent with such and such. What do they really mean by that? And we can thrash it through and debate it and discuss it to get to the nuance of it, rather than just either saying, the doctor said it isn't child protection, therefore it isn't, or the doctor said it is, therefore it is. It's got to be seen in that debatable way, because very rarely are medics in a position to say this is something diagnostic. Much more commonly, we are dealing with nuances that have to be explored, that have to be discussed, that have to be seen in that bigger context.
Thank you, Peter. And just to kind of tell colleagues, we are in the panel, we'll be producing some practice guidance later this year, it's right, isn't it, Peter, about bruising in non-mobile babies. So that's wouldn't have affected either of these children, but I think it makes those really important points that Peter's just conveyed very clearly in relation to that. So, because we know it's difficult and tricky area. Just on the investment stuff, just to say, yes, we absolutely recognise that, and I think all of the panel really endorse and support Josh McAllister's call for good investment around family help, and that will be considered as part of government's response, not just to our review, but the other review that he did. Steve,
good.
Got
Thank
time
you,
for a
Annie.
couple more?
Yes, I think we have, and of course, anybody is welcome to come off mute and just put their hand up and ask a question verbally. There is some more going into the forum as well, so let's just encourage that. I think perhaps pick up on the number 11, talks about did we hear the voice of the families or children who had experienced child protection? So that's a slightly different question around what the impact of the reaction to the extended family in both these cases, and their insight and information. But what are your thoughts about where the voice of the child is, or how that affects the case?
So, I mean, just sort of quickly on that, we know this is really important, and for this review, given the time and other constraints, our focus had to be on talking to family members and those family members who wanted to talk to us. But it was quite a lot, wasn't it? It was about 8, 9, 10. As part of our wider work, we are actively looking at how do we support in reviews the voice of families and children to come through, and we see some reviews where they do that really well and really powerfully, but we all know, and it's a challenge for the panel as well as for local areas, that we need to do that more kind of robustly and to invest in that. Josh McAllister's review did do, because it was over a much longer period of time, over a year, he certainly had a lot of, there is a lot of evidence if you go to his review, which is the voice of families and children who've experienced being on the receiving end of child protection. In our stakeholder sessions, we did invite some organisations who kind of, if you like, have that, do that work. So Quorum, Family Rights Group and so on. We did certainly involve them, but it was relatively limited. Oh, Renika's got something to add.
Renika, yes.
I think the comment also referred to our general work, and we encourage review writers to bring the voice of the child to the fore, not just in terms of what was said, but also in terms of ethnicity, culture, diversity issues, and most importantly, in some ways, child development. So the real granularity of all aspects of the child's development to look at the impact of the situation that they're placed in. So it's very important to us.
So great, thank you to all three of you. I think there's perhaps another couple of topics we could pick up on, but I'm going to encourage us to then get back to people around that. And just to almost finally just pick up on number 40, which as a rhetorical question for right now, of course, it's a really deeply important question. It says, do we need to completely redesign the system, or should the system just do what it's meant to do?
Simon.
So Steve, very briefly,
Yes.
because I know we're running out of time. So look, let's get some context into this. We see 500 cases a year, but there are hundreds of thousands of interactions every year by dedicated, committed frontline professionals that are doing a great job. The system isn't broken, but the system lets you all down. And you as practitioners, I think, are probably let down more so than anybody else, other than the families and obviously the children. The system needs to work. The arrangements for sharing information are there. The legislation is clear. When it's a safeguarding matter, share the information. The system is not broken. We just have to make sure that we use it that much more efficiently and effectively. And ultimately, it comes down, from my perspective, to that ministerial leadership at the very top to provide that strategic guidance, strategic leadership, and then to make sure that practitioners have everything that they need. And that means leaders that have to create and invest in these multi-agency teams, MASH work, child protection units will work, peer support to help strategic partnership or safeguarding partnerships will work. It's not broken, but we just need to make it better.
Yeah. Great, thank you, Simon. Really good point to end on. Listen, we know that the 200 or so people who were on the call have taken time out today. I know you're very busy professionals, so thank you very much indeed. I just want to hand back to Annie just to close us out.
Thank you so much for some really kind of positively provocative questions, some really helpful kind of insights and reflections. You'll get a kind of write out of this in due course, and we are taking forward the kinds of questions and issues that you've been raising, and we will continue to address them in different ways in different contexts. So thank you very much, and I hope that that's been useful.
So thank you, everyone. Please have a good afternoon. And just so you know, the link to the forum will remain active and live for another 48 hours. So when you leave and think, oh, I should have said that, or I wanted to comment this, or any good practice that you know is working in your area that you want to share with your colleagues, please go to the forum and put it in. And then, as Annie says, we will pick up on that and report back to you in due course. Thank you, everyone. Have a good afternoon.